So good morning, everybody. My name is Michael Foley, the Ceramic Implant Guy. I'm very excited to have you listening to us today. I have Adrian Hunn, the CEO of ZERAMEX Worldwide, joining us. And good morning, Adrian, or good afternoon from Zurich.
Good morning, Mike. It's afternoon in Zurich.
It looks colder than it is here in Miami as well.
Actually, you know, the start of April was very, very warm, but now it's a little bit cooling off.
Perfect. So I wanted to do just a quick intro to ZERAMEX in the United States. Many people don't know, Adrian, that ZERAMEX Worldwide is the largest ceramic implant company and has brought a lot of innovation to the worldwide market. The United States, as you know, we're a relatively new company. We're only 3 years old in the United States, but I've been around for quite a long time. So I'm excited to have you here. Before I do that, I wanted to share some kind of housekeeping events and things with our viewers. You're welcome to stay on here with us. First, Dental Tribune has put the first ever ceramic implant on the cover of the Implant Tribune Implants magazine. It's a nice article in here. We have an ad. If you want to get a free marketing material, we will mail that to you. So there's an ad in here, and I'll share the link in a moment. In addition, there is a case presentation. This is a 1-year follow-up of a ZERAMEX XT case done by Swiss dentist Dr. Jen Starch, who works a lot with you. So that's one thing. Very proud of that. Very exciting. Two, in the United States, many people have been asking for a long time, and this is something that you guys are already doing in Europe, for a Find a Dentist feature. So I'm going to share now that we do now have a Find a Dentist feature for all of our current customers and future customers, so that we can advertise direct to the patient, educate the patient on ceramic implants, and then help those patients find a surgeon near them. So I'll share this screen here. This is a new page, ZeramexUSA.com/find-a-dentist, and /find-a-dentist, and check your listing. So what everyone does, every customer has an opportunity to create their own profile. If you are an existing customer, the page has already been started for you. We want you to log in and add the details. The more information that you put in here about yourself, the greater your chance of success and educating patients on what you can provide. So video sells the best. Dr. Ordonez has optimized this page very nicely. Check out what we're doing here. I think this will be a really nice tool to help patients around the United States find surgeons locally. Third thing, as we're not traveling anymore, we're trying to be a little bit unique and differentiating. I have a sample set of our surgical kit and our parts and pieces. If you would like to play with our ZERAMEX XT parts and pieces, we will physically mail them to you, and then you and I can, or the doctor and I can do a one-on-one call like this. So those are the 3 things I wanted to hit on my end. Adrian.
Hey, first of all, congratulations to the great article in Dental Tribune. And second, I also think that feature, you know, Find a Dentist is a great initiative. We have that here in Europe for a couple of years, and we just saw kind of the last 12 months, we saw an increase by 700% of actually patients looking for dentists who are placing ceramic implants. And you know, I'm pretty sure you will see the same results in the US. It's actually, you know, patients are looking for ceramic implants, and we feel that, and you know, we can also express it in numbers.
Yeah, I mean, I think worldwide the numbers are growing tremendously. I'm excited to have this. I hope it'll help all of our customers, and that was the point of it. So Adrian, tell us a little bit about yourself. I didn't do an intro, so tell us a little bit about yourself. You joined the company several years ago and became officially CEO on January 1st of this year. So tell us a little bit about you.
Yeah, that's correct. Before I was in charge of marketing and sales, and you know, I could have imagined an easier start into my new role as CEO with you know, the COVID-19 virus, but you know, like it's
a global pandemic. You didn't see that coming?
No, unfortunately not. Like a lot of people. So I was working in the medical field for most of my career, and I'm actually very excited here together with the team to be part of ZERAMEX, of the company, because we can really change what's going on in the dental industry. We have a small and committed team with talented people, so it's just great. So I love to not talk about me, but about the company. So, we are based in Zurich. By the way, hello from Zurich. In Switzerland, as you know, Switzerland has a lot of roots in the dental industry, a lot of well-known universities. Companies are actually situated in Switzerland, so it's a perfect home for us. We have the production site under the same roof. It's actually just next door, so I can probably spend, like 20% of my day walking through there and asking people stuff. So that's a little about Dental Point. We're in the business for more than 15 years.
Yeah. I think you've got some big shoes to fill. You're following in the founder of the company, right? He was there for the first 14 or 15 years of the business. The founder was the actual CEO, Mr. Jörg Boliter.
Yeah, exactly. He was, he was stepping down. He's still with the company and all connected. So I probably never will be able to fill the big shoes, but I'm trying my best. But, he founded the company 2005. And it's actually a pretty interesting story. It's he had a very successful management, but also entrepreneurial career. And then he started 2005 because he had the ambition, the dream, and of course, also the money to start the project Dental Point, the company. And this was all triggered by a personal experience. So he himself undergo like an implant treating, and his body reacted to titanium implants. And
meaning he had implants himself. He had titanium implants.
Correct. And then he, the body reacted not in a good way. The immune system, etc., was a little bit. So he started to get curious, what's the trigger and what could be done in this industry, because he had no experience in the dental industry at all. So he took the time and traveled about 2 years around the world, talked with professors from universities, dentists, etc., to figure out, what should we do? And the outcome was a white implant, a two-piece white implant. And that was the vision from day one. ZERAMEX Dental Point, we never had a one-piece implant. We always tried to do two-piece implant. And it took them 4 years. I was not part of that. It took them 4 years to have the first product. But, they all learned a lot during that process.
Yeah, I think that's one of the things that I always talk about is that this is not our first two-piece implant. 15 years of evolution. There was probably some missteps along the way to get to the ZERAMEX XT, which is really finally taking off and really showing how good the product can be.
Mm-hmm. That's absolutely correct. But if you're completely in a new field with a new material, which is not an easy material, a very, very good material, biocompatible material, and your body reacts really well to it. But you have to learn your way, and I think that differentiates us from a lot of the competitors, because really, for example, my colleague Philip Boliter, the son of Jörg, he was here from day one. He's the chief technology officer, my partner in crime here at Dental Point. And for the last 15 years, he was focusing on the material Zirconia and on two-piece implants. And you probably don't find anybody with more experience in that area than himself.
Yeah. And like you said, it's a very difficult thing to actually manufacture. When ZERAMEX started manufacturing officially, when?
Actually, it's 2017. I always explain the company is going through 3 different phases. The first phase was clearly product development, to develop a great two-piece ceramic implant. And, that phase was definitely, with the ZERAMEX XT, we achieved partially that goal. Of course, we will always improve. So the second phase is actually, we wanted to control the manufacturing process, because only if you control it from start to the end, you're sure about your quality and you learn more about the material and you can do product innovation fast. So this started 2017. So we produce all of our implants, abutments, etc. by ourselves under the same roof. And then the third phase actually started, 1 year, 2 years ago. It's actually global expansion. So now we are distributing ZERAMEX in more markets, more or less every month, going with additional partners. So that's it.
Yeah, I've been to the factory, and these are not machines that you just go to some store and purchase. These are pretty specific for this type of manufacturing. Not I know a lot of it's proprietary. What can you tell us? Tell us the secrets.
I cannot tell you the secrets, Mike, but I can tell you, like, everybody who's ever walked through that factory, even if they're experts in working in ceramics, they're so impressed. Like, they're usually speechless and they're completely convinced. Like, usually if visitors comes, I'll do my CEO presentation, talk about the industry, they listen, they think it's great, but as soon as they have the factory tour, now they're convinced.
Exactly. We talked and we were going to do a factory tour this summer. Remember, we were going to set that up and bring some American doctors over. We'll see how that plays out now. Maybe we can reschedule that for later in the year or hopefully next year. Going back to the founding of the company, there's a lot of science behind this company as well, which a lot of people don't know. Tell us a little bit about Jörg was partnering, and as he's developing this, who were some of the people and what were, like, how did he even come up with the idea of having a ceramic implant and get it out to the market?
Like that's when Jörg traveled around the world and talked with these guys, he came out back with the vision 2-piece white implant. Now you have to do it. Like, first of all, you're working with completely new material and in a field where everybody says, this doesn't work, etc. So we choose the path to work with established universities and collaborate with them to develop the product. So, for example, we worked with or still work, just had a call with them yesterday, with the University of Geneva, with Professor Monbelli, who is now retired since about 2 months. And with them, we tested our first products and also developed, especially tested our surface, our special Cetaphil surface, which is sandblasted and acid etched, which a lot of people told us you cannot etch Zirconia, but we can, and it works actually very great. So we worked with them. Then we have actually a study running with the University of Bern. This was started with Professor Buser in 2015, because there's also a long established relationship with this university. And the study is still running, and the results are very promising. It's actually about the 2-piece reversible screw implants, which were still the only ones who have a complete metal-free 2-piece reversible screw implant in the market. But also kind of with Professor Gosar from the University of Bern. We collaborated, he did a lot of histology studies for us, and he was highly impressed by the bone to implant ratio around the ceramic. So I would say, like, it's a great collaboration, and without them, it would be difficult to go alone on a path. And we will continue to work with the universities, and that's one of the advantages of being in Switzerland, because you have a lot of high-class universities in the dental field in Switzerland.
Yeah, so we're bringing you mentioned Dr. Gosar. We're bringing him over in December to do a course called Going Green. That'll be here in Miami. So hopefully that still stands, but we're excited to bring him over.
I can definitely recommend to go there, because like, he is not only a great scientist, but also he is a great speaker.
I mean, his science is on another level. He essentially is the guy that proved ceramic implants integrated and did all that histology work.
Yeah.
So it's really exciting to have him come over. All right, so that's the history. Now we're Dental Point and ZERAMEX is the brand. I get confused, or my doctors get confused. There's Nobel and Dental Point and ZERAMEX, and lay that all out for us once and for all from your point of view.
Exactly. So, it's actually easy and not easy, but I try to make it easy. So Dental Point is the legal entity. Our main brand and the original is ZERAMEX. This is how the product is promoted. We also have our own sales force here in Europe where the product is sold. But because we are considered in the field of ceramic implants as the expert, we get also requests from other companies to help them to enter that field. And for example, we have a white label corporation with Noble Biocare, where Dental Point is the legal manufacturer of the ceramic implant. It's called Noble Pearl. And the Noble Biocare is distributing the product worldwide. I can tell you, it's also a great product. It's coming from the same roof. But the brand we as a company distribute the product and sell the product is ZERAMEX, and this was it from day one. That was the original brand. The legal entity, if we ever get like stock listed. The company will be Dental Point, and the brand in your clinic will be ZERAMEX.
Yeah, in the United States, for us, all we're promoting is the ZERAMEX, and specifically ZERAMEX XT. So that's thank you for clarifying that. Let's get into some of the product stuff. To me, the core of the product is the bicarbo screw. Tell us about the success. Tell us the failures. Tell us about the screw and how that came about.
So like that's probably our biggest like secret, and that it's working. It's also set apart from a lot of our competitors. So like the material we're using now, the Zirconia, is called AT set. That's actually the latest generation, second generation of high-end ceramics. It has a fracture strength of 2,000 megapascal, which is about 70% higher than the most commonly used Zirconia than other competitors are using. So it's a very, very, very hard material. You can only work on it with diamond tools. Right. So if you have the implant out of this very hard material and you have the abutment out of this hard material and you have to combine these two, so you have to find something which is strong but at the same time flexible. Right. And this was a spin-off also from a university here in Switzerland. We collaborated and we came after the carbo screw. So the carbo screw is made out of 60% parallel carbon fibers. That's the secret, that they're parallel, so it can be very thin but very strong, and 40% PEEK. So the carbon gives it the strength so that the whole thing is working, and the PEEK gives it the flexibility to hold together these two stiff pieces. And the whole implant is actually designed with this internal connection to work that way. And I can tell you another little secret. It's actually the PEEK makes the screw also a little bit flexible. So the screw channel is a tiny little bit smaller than the screw. So what happens if you put it in with the max torque of 25 Newton centimeters for the XT, for example, the screw enlarges a little bit after the screw channel, which fills, like the gap. Right, it's like another sealer. Which doesn't leave a lot of space for bacteria. That's also the feedback from the professionals we get. Like if they have to open up a ZERAMEX implant with the screw, they have no smell, which is a very strong sign that there's no bacteria.
Yeah, so it's carbon fiber threads that run vertically down the length of the screw, and I've seen the machine, so I know this. You put the threads into this machine, and then it presses into the shape of that screw. So those threads aren't cut, which is what allows it to stay strong even throughout the threading. You still have those threads running down it.
Exactly, we're using a thermal process because you cannot use any other process, because otherwise you're destroying the fibers.
Don't give away too much information. I've seen this. This is trade secrets here.
Exactly.
This is plastic. This would be a PEEK screw. Very soft, very flexible, very flimsy, I must say. This is the bicarbo. So bicarbo is a really solid, strong rod. I worked out today, but I still would not be able to break that.
Exactly.
Really, really strong, different material. And again, it's so far as I know, we're the only ones that have figured out how to combine the hard zirconia to hard zirconia, lock them together without some sort of a metal sleeve or some sort of a metal insert inside there, which, there's the population and percentage of people that want metal free, and metal free means metal free, no metal at all.
And it's also, it's of course metal free is important for a lot of people. And the other thing is also what is, like that, for example, titanium and zirconia in direct contact, the two materials do not work great together. You will have some frictions and some material. So the solution is actually, zirconia on zirconia. And currently what we see, that the smartest connection for that is the bicarbo screw.
Right. The key is on the zirconia not have any lateral forces. Right. If you have thin-walled zirconia with lateral forces, that's where you have a risk of fracture. Our XT has 0 points of contact that have lateral forces. All of the strength is on that screw, which is, tell us about fractures. That's obviously one of the questions that I hear all the time. Something you see anymore?
No, like I have to honestly say, like for our existing customer base and also people who are actually getting, it's a non-topic anymore. But I would say in general, in the industry, there's still some more ceramic implants fracture. Yes, like this whole thing started in the 1960s, where the famous Professor Sandhaus created his first ceramic implant out of aluminum oxide, which would be aluminum
oxide. Just aluminum oxide.
So, and now we are about 4 generations later with the material. So our material is, like a X% stronger than that. So fractures do not happen with ZERAMEX if you actually follow the protocol. And that's one thing. So we have better material. Then I also think what sets us apart is the manufacturing process. Right. You can work with zirconia in 3 different ways. One is hard machining. So uses zirconia, which is already pressed and sintered. That's the most difficult and the most expensive way. And then there's a green state machining.
That's what we do.
We do the most hard. We do the hardest and expensive way, but leads to the best results. And there's injection molding. But we are 100% convinced, because we're testing all the time, that this is the only way to guarantee like a great ceramic implant which does not fracture, because any small issues in the surface of the zirconia can diminish the strength of the implant. And with hard machining, you don't have the issues. And on top of that, we have 100% quality control with like micro CT scanner, which scans every implant, and we'll see when we have an issue. But I think that sets us apart. And I also think, like the 15 years of experience in 2-piece ceramic implants doesn't harm to do that.
Yeah, I think we're far and away. I have so this is a blank of the hard material that we use. So basically what they do is they take the zirconia powder, we press it, heat it, and sinter it into these rods. So that's why it becomes this hard state zirconia. And then with these special diamond cutting machines, we grind it into the shape of the implants. And that's, again, what eliminates any risk of micro fractures, putting any sort of micro cracks into that zirconia. And not everybody does their implants that way. Mm-hmm. Perfect. Anything else about the product that we want to hit on, or should we get into some marketing and some fun stuff? What's coming next? What's the market talking about? Anything else on product?
We will launch a new couple of products. Like some of them will be available worldwide. Some of them are only available in Europe so far, but we will change that. So what's coming now next in the US and in Europe is the smaller ZERAMEX XT diameter, the 3.5 XT. And the beauty is, same screw, same platform. So you can also, if you like interchange the abutments, take a 4.2 ZERAMEX and put a small abutment up there. So that's coming soon. Within the next 4 to 5 weeks, we should be on the market with that product.
Let's stop there. That's a game-changing product.
Yeah. And exactly, because not every company can put out a product that small in ceramics and still is convinced that it will work. But because of our internal bolt-in tube connection together with the Vicarbo screw, we are convinced that it's working, and all the tests are extremely positive. The second thing is, we have some what we call dog locks abutments, kind of locator, screwed, completely metal-free. That's huge. And in Europe, we launched towards the end of the year, a complete CAD/CAM offering for our customers. That means completely customized abutments you can order from ZERAMEX. You can use a scan body, scan it, design your own abutment, and you order it. And even better, and I don't think the market has understood that yet, you can also order completely customized monolithic crown. So that means you can put the crown without an abutment directly on the implant, and you can screw it. Which, there's no micro gaps, there's no cementitis. It's just one of our piece. So in terms of stability, also cost, to be honest, for the patient, and health in terms of cementitis, gaps, etc. It's a great solution, and we're working hard on that to also launch that in the US.
Yeah. So for the American market, I think the 3.5 and the dock locks, which is a fixed removable, a locator type system, that's I mean, those are both game-changing products. The digital workflow is coming, but it's going to be a bit later. The 3.5, I mean, that's the cosmetic implant. Am I right?
Oh, completely. That's the cosmetic implant. You know, like it will offer your customers a lot of varieties to work in the front with the small implant. You know, it's the wide implant, small implant if you don't have a lot of space. So it's great.
Soft tissue aesthetics with the white color, small size. That is the cosmetic implant. That's a game changer. That's going to be really exciting to have in the U.S. market. Really looking forward.
And I just think, Mike, you know, like especially you mentioned something like soft tissue, especially, you know, in the cosmetic zone, that's huge. And we know from studies that, you know, like a soft tissue gingiva around the ceramic implant, the blood flow is way increased compared to titanium, which leads to better pink and white aesthetics. So, you know, you're right, the cosmetic implant.
Right. It's very exciting. And that's going to be coming soon. Tell us about the market itself. What is, you know, obviously we didn't expect this coronavirus to slow down. What are your thoughts on the market globally? What are the numbers coming from Europe? How much bigger is it in Europe already, the ceramic implant market? Tell us a little bit about the market overall from your point of view.
You know, like I maybe make this twofold. So the market overall is actually growing. You know, like even our competitors and, you know, the famous Marco Cadola, CEO of Straumann, not anymore since the end of last year, but, you know, he said in an interview that he thinks that it's underestimated what the market share of ceramics implants will be in the midterm. And midterm, we talk about 3 years. So he mentioned in an interview he thinks it will be around 10%. And, you know, like in markets like Germany, etc., the market share is again high, but it's still growing. And I can tell you, since I started here, what's going on within the last 18 months with people interested in ceramics implants or want to distribute ceramic implants. It's actually going through the roof. So development is very, very positive, which I think is great also for patients and dentists because it offers new possibilities. Of course, the coronavirus or COVID-19 put a little bit, you know, it's like somebody put the pause button and it's a little bit on pause, but I think in the midterm it will help us because I think, you know, people will be way more health conscious than they were before. It was already a topic because, you know, biocompatibility, you know, all that. I think aesthetics, which is our implant is actually made for, you mentioned the cosmetic implant, is just something that will be more important and will continue to grow. And I think
right. In the US, we have, you know, Whole Foods market, right? That's the client that typically seeks out once and is willing to pay the premium, frankly, for a ceramic implant currently in the United States. And you know, I don't see that market going. I expect that to continue to increase. You want to trust the products that you're purchasing and make sure that it's the best, healthiest thing for you. And the other thing that you and I were talking about before we got online is, you know, I didn't spend that much time on these web calls before staring at my face, right? I think more and more people are now paying attention to the cosmetics of their face. And whereas that little gray line here from a titanium implant bothered them, now it's taken to an extreme because they're sitting on Zoom conferences, they're on web calls all day long, and they're nitpicking their faces more and more.
No, I completely agree. By the way, I used to live 6 years in Chicago, and I loved Whole Foods. So that's probably the job where I most was happened to. So I'm very positive about this, the prospects because of the biocompatible material, aesthetics will be, and also, you know, with the products we have within the pipeline. It's just, you know, like this pause button, somebody will press it again, and then the market will continue. And Mike, I can give you a little bit of scoop, you know, like probably my marketing people hate me for that. So, but we started a little survey, you know, like what kind of implant people would choose, the white, the gray one, and then, you know, it's a survey among patients to show them the positioning of the implant, etc. So, you know, literally like currently 88% of the people were choosing the white implant. So it's if you give patient the choice, and I'm fully convinced you can only give the patient the choice if you're convinced about the product. But there's actually no reason with the ZERAMEX XT that you're not convinced about the product if you compare it with a premium titanium implant. So, you know, the market goes, for us, definitely in the right direction.
Fully agree. Any parting words? I think those are the questions that we wanted to address. And I appreciate you introducing yourself to the U.S. market. What closing words do you have for us? Give us some words of inspiration.
Oh, yeah, you're setting the bar very high. So, the closing words. I'm looking forward to actually come to the US and visit a couple of trade shows and also customers, and also can encourage you, to also visit our website. And if you have questions, reach out to Mike, reach out to us. We are there for you. And if you want to differentiate yourself now and position yourself for the future while your clinic is closed, this is the time. And ceramic implants is part of that future. So you better start now and you will not regret it.
Thank you always, my friend. Good to talk to you. Stay safe. And thanks for coming on.
Stay healthy. Bye, Mike.
Sure, guys. Thank you.